is a small country in a turbulent neighborhood. It's seen the influx of millions of refugees from Syria, Iraq and the Palestinian territories. It's suffering its own economic crisis with high unemployment and protests over tax reforms. But in the area of healthcare, it's made huge strides. The King Hussein Cancer Foundation has become one of the leading NGOs in the region for cancer care, and its transformation has been accomplished by a woman who campaigns tirelessly for better healthcare for cancer patients everywhere in the world. She's a member of Jordan's ruling royal family. She's also the first Arab Muslim to take the presidency of the global cancer control organisation, the UICC. With World Cancer Day on February the 4th, I speak to Her Royal Highness Princess Dina Mired of Jordan one-on-one.
Had I been an underprivileged person in Jordan, I would not be able to call myself a mother of a cancer survivor. Are we going to be the generation that's going to just sit back and see 18.1 million new cancer cases? Iraq and Syria were our top trading partners. You can imagine how much it has impacted our economy. Do I see myself as a role model? No one does. No one does, really.
You call yourself the mother of a cancer survivor. Tell us about that time and how it felt when you learned of Rakan's illness and what it was going to take to put him on the road to recovery.
Well, first of all, lovely having you here. Very happy to be doing this interview with TRT World and especially with you, Shuli. We've already become fast friends and I'm very happy about that. Yes, when we, in 1997, November 1997, 2 days short of my son Rakan's second birthday, we found out he had leukemia. Of course, like any other parent, you know, and especially in those days when nobody spoke about cancer in 1990, certainly not here in Jordan. It was never on the radar on any young parents, to say the least. We felt the same feelings that one would feel: shock, horror, guilt. Why didn't I discover it earlier? Worried that you're going to lose your most precious with a disease that we all thought it equates to death, because that's how it was in 1997. And it was a very, very sad, fearful time with lots of worry and you know, the usual emotions that one feels when you are faced with such news as this.
As a parent and as a family, it must have been a terrible time.
It was an awful time. But to be honest, then, you know, as parents, you quickly, you know, beyond the first few days when you, of course, you're gonna cry and wonder, and why me, what else could we have done, and you know, what else could we have picked up, and so on, you snap into action, because you realize that now you have a child to help save, of course, with the team that is at the hospital and so on. And we were at the time, we happened to be in England, and we were at Addenbrookes Hospital. That's when the first news was broken to us that Rakan had leukemia.
And he has since recovered happily with the help of a bone marrow transplant from his sister. But that really set you on the journey to what you do now, which is passionately advocate for equality of access to healthcare for all patients, regardless of their income, all around the world.
Well, after we finished, you know, the treatment, we first, of course, finished the chemotherapy treatment. In the beginning, we were at Addenbrookes at the time, and then we moved to the US because we were told that you need to go to a place that deals with more bone marrow transplants, more volume, and so on. So we went over there, and after the treatment finished and we came back here in Jordan, believe it or not, you know, we were so fearful to come back because yes, we did have at the time a cancer center. It used to be called the Hope Center. Notice the omission of the word cancer in the name. I used to pass by it every day on the way to see my parents. and we just ignored it. It was a building. Yes, it had fantastic machinery, the infrastructure was there, but it wasn't known to be a place where it saves lives. And certainly there was so much taboo at the time.
Because at that time, a diagnosis of cancer was basically a death sentence.
Death sentence. So we were so fearful to come back because, we felt, what if something happens again? What do we do? And it was a very difficult time for us.
Is that when it hit you that healthcare wasn't adequate in Jordan?
Yes, certainly I felt very appreciative of the fact that we were of the lucky few who were able to get top treatment, be it in England and then later in the US. And certainly, if I had to think for 1 second that had I been an underprivileged person in Jordan, I would not have had this chance, and certainly I would not be able to call myself a mother of a cancer survivor. And that's when I was asked to join the King Hussein Cancer Foundation at the time and to become the Director General for the institution. And at the time,
you transformed that institution through
and
your
that's
hard
when
work.
And there was nothing in the foundation. It was just a legal entity, and there was this cancer center. They used to be called the Hope Center. And when I entered with the foundation, it really started from scratch. And it wasn't just me. It's, nobody does anything all by themselves. Of course, there was the center, the Hope Center. At the time, we had the machinery, it had staff. And as you know, healthcare in general in Jordan, in terms of capacities, human resources, it's there. We're highly educated people. But operating a cancer center or managing cancer control in a center, that requires a whole different mindset and a whole different skills.
Managing it and resourcing it
and
funding it.
It's a different story altogether. So at the time, despite having this wonderful center, and we thank all the people before us who built it, and it was there, but it wasn't saving lives. So we worked very hard together with the Board of Trustees, the CEO of the center at the time, and myself at the foundation. We were like a tripartite team working together, first of all, to put cancer on the agenda, to put it on top of mind, to out it actually, because at the time nobody would even speak the word cancer. They would refer to it as that disease, or God forbid, that disease. And so how are you going to, fight a disease when you haven't even, admitted that it exists and so on? So we all started to look into what we can do. And the first thing we thought, why reinvent the wheel? I went to St. Jude's Children's Research Hospital at the time, and I'm very thankful for them because I learned everything that I needed to learn. In those 5 days I went, and I was actually pregnant with my third child, Jafar, and met everybody. I was like a wonderful student sitting there, talking to them, understanding how they do fundraising, what are the systems for fundraising, how do you do it professionally? Because clearly, if you're going to fundraise for cancer, and we needed to fundraise a whole lot of money to be able to bring the cancer care up to scratch.
Because this is one of the big problems, right? That poverty directly impacts on people's access to both treatment, to preventative measures, to screening.
Yes. I mean, I think many people in the Western world, yes, they might have some issues with their healthcare systems, but they have them. They have the universal health coverage. It might not be perfect in so many ways, but it's there. And certainly when you are faced with such diseases, so complex and so costly, such as cancer, you're really so lucky to have those, the access, the financial access for those. Because, access, as I always say, it's such a simplified word when you say access to cancer care. Access to cancer care has so many meanings. Access to information, access to awareness, access to, or let's say, beating the barriers to access, such as stigma, such as taboo, fear, etc. And then access to cancer care facilities if you have one, or you live near one. And if you have one, do you have access to a quality care facility? That's another issue, because as we all know, cancer knows no mediocrity. You either get treated to the top of protocols for cancer care, or don't bother, right? Because the side effects can be very debilitating. And then you have, of course, if you happen to have access to a cancer facility in your own country, then what about having the financial means to pay for it? And that's the story of many countries.
And this is something that you talk a lot about in your role as President of the Union for International Cancer Control. You are the first non-medical person to take the helm of that organisation, and also the first Arab Muslim. What are your goals for your presidency of that organisation?
Well, first of all, I put myself up for election because I bring in different perspectives. First of all, as a mother of a cancer survivor and a carer for a child with cancer, I bring in the patient perspective. Second of all, coming from the developing world, I bring in that perspective. Of course, many people know about the situation in the developing world, but I've lived it. I've seen it. When you talk about lack of access, I've seen a child being turned away because their parents didn't have money. Or I've seen all of these tragic cases that you talk about, not from textbooks, but I've seen it and I've lived it. And thirdly, having been a Director General of the King Hussein Cancer Foundation for 15 years and starting from scratch, building the foundation, the structure, the human resources, understanding the awareness challenges or the lack of awareness about cancer, the lack of money for cancer, and so on, and the systems and the organizational capacities. And that's what I would say many of the issues of the developing world is very much organizational and systematic way of dealing with cancer control.
You clearly have the knowledge in the background.
I'm able to bring that. So what I would like to do during my presidency is to continue fighting for equity, for cancer treatment for all. And this is actually what's the theme for our World Cancer at UICC. I am and I will, and we're calling for treatment for all. Because yes, we are focusing on treatment, but of course we also focus on the whole cancer spectrum. Prevention, early detection, treatment, palliative care, survivorship, and so on.
All of this requires...
treatment is the big elephant in the room.
All of this requires commitment from governments.
Yes.
And you have spoken before about the slow pace of change. You were speaking at the UN last year, and there was definite frustration in your speech about how far we've got. This is something, reducing cancer deaths is a UN goal, it's a World Health Organization goal. Why is it so slow to be achieved?
Actually, more than half of the countries in the world are way behind in improving cancer control in their own countries. And this is really frustrating, especially since the global advocacy world, the health community, we've really moved the agenda forward from 2011, when I first spoke as well at the UN high-level meeting, where we were full of hope, and we thought the fact that we have fought the denial about non-communicable diseases, and cancer being, of course, one of the big non-communicable diseases. We thought once we break down the denial about that developing worlds don't suffer from non-communicable disease, that everything will be okay. And we've gone through the plans, the action plans, we framed and reframed our cause to make sure that countries start implementing all the advice and all the initiatives and all the policy guidance.
Why aren't they doing it?
And really, they're not doing it. Lack of political will is one. Prioritization, lack of planning. Again, I go back very much to the management of cancer control. How are you gonna, in your day-to-day life or in any successful business, you put a goal, you prioritize. After that, you do a strategy. Based on the strategy, you put an action plan. You put date, time, person responsible, and so on. Many countries are not doing that. Many countries
critics
don't
would
have
say
national
that
cancer plans. So
many
how are they
governments
gonna
don't have the money to do that. So how
But
can they
that's-
implement cancer
yeah.
plans when they have conflicts and poverty and diseases like AIDS and malaria to deal
Yeah,
with?
but that's not the whole story. Not everything requires money. For example, if I talk about palliative care, providing proper palliative care for many patients who don't survive the disease, and certainly 70% of deaths are in the developing world. This doesn't require that much money. It requires planning, organization, and prioritization. Morphine is very cheap. Many countries, they are able to buy it, but they don't distribute it. They don't disseminate it. So it's not a question of money, it's a question of bureaucracy.
Do you feel that one of the things you bring to the table is the fact that you are royalty, you are a princess? Does that make it easier to open up doors and talk to the policy makers and the decision makers who can influence these decisions?
Well, the title, of course, it does open up doors. I am able to meet top leaders, presidents, and decision makers. Yes, I am able. So that's opening the door, that's one. So, and I've seen, and that's really good to be able to do that. But at the end of the day, those countries have to roll up their sleeves and decide, are they going to be just waiting to see, are we going to be the generation, all these governments who do nothing, are we going to be the generation that's going to just sit back and see 18.1 million new cancer cases every year and accept that 9.6 million per year die, and 70% of which in our own countries, in the developing countries. They have to decide, are they just going to sit back and do nothing, or start doing something? Whether on prevention with tobacco, you cut down 30%. You cut down lung cancer, and it has been proven. Or whether with screening and early detection, cervical cancer. Many countries suffer from cervical, and it can be prevented, it can be screened. Breast cancer, we did it. We are, and that's the thing is, I think where I bring to the table is I can tell those countries, we've done it. Jordan isn't exactly a rich country. We're a medium to low income country, resource country, and our story is proof of the pudding. Before the King Hussein Cancer Center's success, Jordan used to send the few to be treated abroad, wasting millions and millions of dollars, actually improving or giving revenue to other hospitals abroad. But when we finally fixed our own cancer center, we've cut the bill by, I would say, 60%, because here, cancer treatment is much cheaper. It's certainly not the same as in the US and Europe, I suppose. And at the same time, being able to deliver quality cancer care, not only for the few, but to the whole population. So we've done it. It is doable. Was it easy? No, it wasn't. But it was very important that, and I tell this all the time during my visits, you can't sit passively waiting for help from other countries. You still have to do your own homework. Find out what you can do, remove inefficiencies, remove barriers, and then you ask for help.
Let's talk a little bit about Jordan, because Jordan, as you said, small country, low to middle income, it has been impacted massively by the war in Syria, by the conflict in Iraq. It's generously taken in over 1 million refugees. How has that changed Jordan, though?
Definitely. I mean, Jordan is such a lovely country, by the way. It has really, this is not the first time we accept refugees. Jordan has accepted Palestinian refugees, 1948, 1967, then the Iraqis from Gulf War #1, Gulf War #2, and then now, of course, with the Syrian crisis, we've accepted more than 1 million plus refugees. So it has definitely impacted many things. Certainly the health and educational sector has been really, really overburdened. And when I was Director General at the King Hussein Cancer Foundation, I saw that. And what I really saw, and I was very surprised, is how little the humanitarian agencies such as UNHCR, HCR, and WHO, how little they have in terms of resources to help refugees with cancer and non-communicable diseases. They're mainly geared for emergency type situation, but they have absolutely hardly any money for cancer.
Is it changing the nature? Is it changing the atmosphere in Jordan? Is Jordan finding it a struggle? For example, dealing with the financial burden of looking after so many refugees at a time when its economy is really struggling.
Of course, we have been impacted. Don't forget that, Iraq and Syria were our top trading partners, to say the least. So having that, diminished or even stopped, you can imagine how much it has impacted our economy. And then to add to the mix all the other issues in the Middle East, and the Syrian crisis, and of course accepting our brothers and sisters from Syria. And I don't think this was an issue ever, whether to accept or not to accept, because this is the way of the leadership.
Jordan has accepted so many refugees. Do you think that international organizations are doing enough to help with the humanitarian challenges that they're facing and with the financial burden that Jordan is facing?
Well, they're not doing enough. And we have to remember that actually WHO and UNHCR, they get their money or their support from member countries, from governments. So in a way, they should be seeking more assistance from those countries to help the refugee population as a whole, meaning you cannot just look at a refugee and think that this refugee is only suffering from emergency care. These refugees are humans just like you and me, who are also mirroring the same diseases that we all suffer from. And if NCDs are the #1 killers right now in our time, killing 18.1 or affecting 18.1 cases per year, many of those will happen to be refugees as well. So they need to start demanding more monies from governments around the world, so that when there is a refugee situation, and apparently we've seen, it's a record number of refugees all over the world, not just in Jordan, they need to rethink their assistance for the refugee population to include non-communicable diseases and to include cancer. And they've started recently, I think, with diabetes, diabetic medications and so on, but cancer has received very little, if none. So they need to really demand more forcefully, more assistance and care with regards to cancer.
Do you think the refugees themselves feel abandoned? Do you think refugees feel that not enough is being done for them?
Absolutely. I mean, I've seen, we've helped during my tenure as Director General of the King Hussein Cancer Foundation. We've had to help so many Syrian children and patients through our goodwill funds, from donor goodwill funds. We've helped so many, and I believe to this day. But we cannot help a whole population all by ourselves. We were and we are a non-governmental organization after all. And of course they know that some die, some get underreported, some don't even know where to go and where to start. And because of their situation, if they do come, they present themselves very late when there's very little to be done for them and so on. There are so many tragic situations that we don't even know about, of refugee population, many patients dying without no chance for even trying to beat the disease.
Can I ask you, you are very much a role model, particularly for Arab women. You have helped change healthcare on a global, regional and national level. You've done all of that while raising 3 beautiful children. What is your goal? Where is Your Highness Princess Dina Mired's future? What do you want to achieve for you? Do you have time for you?
Oh, for me. I haven't thought about that actually, because I've been so busy, and my focus right now is to utilize my position as president of this wonderful organization, the Union for International Cancer Control, and to really utilize what I bring into the role, and to advocate in wherever I go.
Do you see yourself as a role model?
Yeah, well, you know, what is a role model, right? Nobody's perfect, but I feel like I want to make sure that I knock on all doors and put in the hard work that is necessary to advocate for treatment for all people, regardless of where they live, regardless of their income level, because that's their right to be able to face the disease of our times, which is cancer. Do I see myself as a role model? No one does. No one does, really. But I feel I am trying my best, and I think this is what the most, you know, trying to improve oneself all the time.
Well, it's been an absolute pleasure to speak with you. Thank you very much indeed, Your Highness, for speaking with TRT World.
Thank you so much. Thank you.